disorder, I tried to kind of make this a little bit, oh God, you're videotaping me, videotape the screen. Make this a little bit fun, and there's 1,000 different memes out there about what it means to be bipolar, and people use it as kind of the punchline in a lot of jokes. You know, oh, you must be crazy, you must be bipolar, you know, you can't make up your mind, that kind of thing. So I tried to kind of insert some of these in here to inject a little levity. So introduction. Bipolar disorder is complicated and often life-altering. According to the National Alliance of the Mentally Ill, the average age of onset is about 25. It can occur in the teens or more uncommonly in childhood. The condition affects men and women equally, with about 2.6% of the U.S. population diagnosed with bipolar disorder. Nearly 83% of the cases are classified as severe. And here's a little meme. I used to have superpowers, but my bipolar meds took them away. A lot of times when people are having manic symptoms, they can feel very much like they have superpowers. They might have unlimited energy, unlimited creativity. A lot of famous artists throughout history have had bipolar disorder and have been their most creative when they have been in a manic state. So diagnosis. To be diagnosed with bipolar disorder, a person must have experienced at least one episode of mania or hypomania. Hypomania is not quite the level of mania. It's more of, might be more excitability or more energy, whereas full-blown mania could present itself looking like they may not sleep for several days at a time. Mental health care professionals use the Diagnostic and Statistic Manual of Mental Disorders to diagnose the type of bipolar disorder a person may be experiencing. To determine the type a person has, mental health care professionals assess the pattern of symptoms and how the impaired person is during their most severe episodes. There are special populations to consider. Women with bipolar disorder who are of childbearing age or considering getting pregnant need special attention. A lot of the medications are not safe to take when you're pregnant or breastfeeding due to the risk to the child. So a complex risk-benefit discussion needs to occur to look at the treatment options available. Some medicines have risk to the fetus and to children through breast milk. There is also evidence that being off of those medications increases the likelihood of bipolar symptoms, which is in itself a risk to the mother and the baby or the fetus. Planning ahead, getting good information from your healthcare team based on your circumstances improves your chances of a best outcome for the woman and the baby. As far as children goes, the diagnosis of bipolar in children has been controversial. According to the Diagnostic Statistic Manual, individuals must be aged 18 or older to receive a bipolar diagnosis. Before receiving any psychiatric diagnosis, they must have a comprehensive evaluation of their physical and mental health. If they have symptoms, they may also be evaluated for other conditions, including attention deficit disorder, early childhood psychosis, post-traumatic stress disorder, learning disabilities, or substance abuse problems. Children with bipolar symptoms usually receive psychotherapy and psychosocial interventions before meds are considered. There is a new mental health condition called disruptive mood dysregulation disorder that can be used as a child's diagnosis. It better describes the symptoms such as intense irritability, temper tantrums without the classic symptoms of mania. There's another one. I'm dizzy from riding your bipolar coaster. So causes. Genetics is the biggest one. The chances of developing bipolar disorder are increased if a child's parents or siblings have the disorder. The role of genetics is not absolute. A child from a family with a history of the disorder might never develop the disorder. Studies of identical twins have found that even if one twin develops the disorder, the other may not. Stress is also a cause. A stressful event such as a death in the family or illness, difficult relationships, divorce, or financial problems can trigger a manic or depressive episode. Thus, a person's handling of stress may also play a role in the development of the illness. Another cause, brain structure and function. Brain scans cannot diagnose the disorder, yet researchers have identified subtle differences in the average size or activation of some brain structures in people with the disorder. Here it comes, depression. There's two types of bipolar, which is the next slide. Bipolar type 1 involves manic symptoms that last at least 7 days, or their symptoms are so severe that you need immediate hospital care. Depressive episodes are also common. Those usually last at least 2 weeks. They can also involve mixed episodes where you have pieces of both. There might be psychosis, there might be hallucinations. There might, again, with type 1, you're more likely to see those extreme manic episodes where you have the days without sleep. You might have excessive spending. You might have really risky behaviors like, sex with multiple people in a short period of time, increased drug use, blowing all the rent money at the casino instead of paying your bills. Bipolar 2 involves more depressive episodes. So instead of a full-blown manic episode, there are episodes of hypomania. For example, they might have more energy than usual. I myself have type 2, so that's why I tend to talk about this quite a bit, to bring some acknowledgement of it and to kind of reduce stigma. For example, when I had a hypomanic episode, to me, that looks like remodeling my entire kitchen in a weekend, followed by a period of depression where I can't get out of bed and it's very difficult to function or attend to like ADLs. Like it's hard to get in the shower, it's hard to get out of bed. Cyclothymic disorder or cyclothymia involves hypomanic and depressive symptoms, but they're not as intense or long-lasting as hypomanic or depressive symptoms. The symptoms usually last at least 2 years in adults and 1 year in children and teenagers. Bipolar, great in bed, but hard to live with. Again, that goes to the manic type 1 type. Because that is, a lot of times when people talk about it, they are very sexually active. They are very risky. There's a lot of, kind of that dangerousness. So mania symptoms, feeling very up, high, elated, jumpy or wired, more active than usual, having a very short temper or seemingly extreme irritability, racing thoughts, talking very fast, needing less sleep, feeling like you're unusually important, talented, or powerful. For example, I had a patient today tell me that when she gets off the plane, when men from Jamaica get off the plane, they smell her out because that's how talented and amazing she is. Oh, okay. I'm like, wow, all right, interesting. They do risky things such as show poor judgment, such as eating or drinking too much, spending, giving away a lot of money, or having reckless sex. And again, they may experience hallucinations. I can tell you my daughter has type 1 bipolar, which for her began at about age 11, which is more unusual. Her symptoms were she had severe hallucinations.
She's hearing you.
She's hearing me?
Yep.
Yes. I know. She knew I was going to talk about it. She had hallucinations that were incredibly disturbing, incredibly scary. And because you can't have that diagnosis as a child of bipolar, they were labeling it psychosis, they were labeling it early onset schizophrenia, and instead of managing the mood component, which underlies all of bipolar disorder, they were throwing every antipsychotic in the book at her. She was on everything down to Clozaril. It was nightmarish. And it was only after I basically pulled her off all of those meds and we started over with a new psychiatrist that he said, you know what, let's get you on something to stabilize your mood. And boom, like the hallucinations disappeared. It was kind of crazy. Symptoms of depression, feeling very sad, hopeless, or worthless, feeling very lonely, isolating yourself from others, talking very slowly, feeling like you have nothing to say or forgetting a lot, having little energy, sleeping too much, eating too much or too little, lack of interest in your usual activities, being unable to do simple tasks, thinking about death or suicide. And then the symptoms of a mixed episode that can include manic and depressive symptoms together. You might feel very sad or empty or hopeless, but at the same time you feel very energized. So that is kind of a dangerous time when someone is experiencing a mixed episode because when they may have been very depressed and had suicidal ideation. It's during that time that it's more risky that they're actually going to complete suicide. They now have the energy to do it. Hypomania. Symptoms, they may be milder. For example, you might feel very good. You can get a lot done. You might not feel like anything's wrong, but your family and friends are noticing your mood swings and your changes in activity levels. They may realize that your behavior is unusual for you. And after the hypomania, again, you might have severe depression. I'm always having mood swings. Do you think I may be bipolar? Odds are good. So treatment. Psychotherapy is one of the main focuses of treatment in individuals who suffer with this disorder. Cognitive behavioral therapy helps change the negative thinking and behavior associated with depression. The goal of this therapy is to recognize those negative thoughts and to teach coping strategies. Family-focused therapy can help people with the disorder learn about the illness and carry out a treatment plan. And psychotherapy focused on self-care and stress regulation helps a person improve their self-care, recognize patterns of the onset of the symptoms, and to manage their stress. I was unhappy earlier today, but I'm happy again. It's so bipolar. Another treatment option, medications. Lithium is the gold standard. It stabilizes mood, it prevents highs and lows, but it does require frequent laboratory monitoring, which, the window is very narrow. That's the therapeutic window. And if you are too high, you could have toxicity, which can be, poisonous to your system. Too low, you're not going to have good symptom control. So it is a very difficult medication to manage. You can also use anticonvulsants like Depakote, Tegretol, or Lamictal. Second-generation antipsychotics such as quetiapine, olanzapine, or aripiprazole. Antidepressants, those need to be especially monitored because they can be very triggering for manic episodes. Examples would be Zoloft, Wellbutrin, Lexapro, or Prozac. And then there's combo drugs, which this one is my personal favorite, Symbyax, which is a combination of Prozac and Zyprexa. So you get more bang for your buck. It's 2 meds in 1 pill. And the people that I've started on recently, they're doing well, so it's good.
And then what was the name of the other medication that you said that the insurance don't cover?
Vraylar is another good one, but Husky covers it 100%, but most of the other insurances don't, and it's very expensive. So it's anybody that's not on Husky, it's really kind of difficult. So bipolar risk-taking is a symptom. Treatment, other options. ECT is electric shock therapy. Involves sending an electric current through the brain to cause a controlled seizure. It's not really known why it's effective, but it's thought that it changes the brain chemistry, and that is performed in the hospital. TMS, which is transcranial magnetic stimulation. This is actually performed in an outpatient setting over the course of 9 weeks. And it stimulates the brain via magnetic pulses. It's kind of interesting. I had done a rotation with Greenbrook TMS, which you sit in kind of this little chair. They put a helmet on you, and they direct this electronic pulses into your skull, and it's really kind of crazy. And it does, the research is that it does work. But then there are other people that get all the way through the 9 weeks and really have no difference. So I think it's very person dependent. And then there's also esketamine or Spravato, which is kind of a newer thing, nasally inhaled for treatment-resistant depression, and that is performed weekly on an outpatient basis. And that is Special K. That's an old school party drug. Okay, so to summarize, bipolar is complicated to diagnose, more complicated to treat. With the proper meds and therapy to address your symptoms, it is manageable. People that are being treated can lead happy and productive lives with excellent symptom control. And that's it. Does anybody have any questions?